Hello, my name is Diana Karamakoska, and in today's topic we are looking at interviewing do's and don'ts. When you're in an interview, it is okay to take notes of what the client is saying, and you can complete a form at the same time, but don't let this distract you from listening to the person and their story. It's very important that you remain attentive to what they are saying. Be succinct in your note-taking skills. It is also very important that you maintain eye contact and an open posture so that your client views you as a safe base in which they can disclose information to. You should also maintain interest by nodding every now and again and paraphrasing back to them what the client has said. A few notes on what not to do when you are interviewing a patient. Don't ask loaded or double-barreled questions. You should also avoid judging their behaviour at all costs. It is your job as a health professional to assess their situation without any judgment being made whatsoever. You should never interrupt your interview to answer the phone or to speak with others unless it is extremely urgent. You should also avoid focusing hard on the questions that you want to ask and what needs to be answered, because this might result in you forgetting the patient and it will seem as though you are ignoring them or being inattentive. Do not yawn, fidget, or look away from them as they are speaking, as these are signs of boredom, disinterest, and it can make the client feel very uncomfortable and awkward so that your therapeutic relationship already becomes strained. Try not to allow facial expressions to become obvious, for example, when you appear shocked. This might heighten the anxieties or fears of the client as to when they are explaining something to you. We need to make them feel at ease and comfortable, and so we try to keep our emotions under control as they are disclosing information to us. You might be wondering what double-barreled questions are. Well, it's simply when you ask two things at once. This actually confuses the person being interviewed, and they often do not answer either of the questions well. So something like, do you go to the gym each week, and what type of exercises do you prefer when you get there? Asking something like this is very presumptuous and implies a sort of judgment that you will make about your patient as to the responses they give. Loaded questions also infer judgment and hinder a true response from the interviewee. Saying something like, "You don't smoke, do you?" and "You exercise regularly, I presume?" These types of questions can make a client feel uncomfortable because they are assumingly judging them if they say no or of course, and it makes them feel less confident to speak to you about other matters. When you're completing the interview, make sure you always ask, is there anything else you would like to add? This gives an opportunity for the interviewee or the client to expand on any information or to bring up something that you had not questioned them about already. Make sure you thank the interviewee for their time as well for coming in to see you. This will also encourage them to come back and see you again should any checkups or follow-ups be necessary. And make sure you stand and shake the hands or smile and say goodbye until the next visit. Again, we are trying to establish a therapeutic relationship between ourselves and the client, and one that's going to make them feel comfortable about approaching you on any issue that they are having.